so much for that overview of all the fancy technology that we are working with today. And thank you, everybody, for joining us for this flipped classroom webinar. I think lots of folks are still signing on, but we'll go ahead and get started. We really want to make sure we have ample time for Q&A with our guests who have been so generous with their time to pre-record a webinar and then be here today. So again, thank you so much for joining us. We are really excited about this new format. Thank you for experimenting with us. It's the first time that we have done this, and we're really excited to see that so many of you all seem to be excited about it as well, and have hopefully had the chance to dial in to hear the webinar recording and then to join us today. I'll talk just a little bit more about the format in a moment. My name is Lauren Rabinowitz, and I am joined by my colleague. I don't know if it looks the same on your screen as it does on mine, but she's right next to me on my screen, Kate Wasserman. So the two of us are from the TA Network, and we co-facilitate this early childhood learning community. And then we are also joined by some other esteemed colleagues that are going to be introduced in just a moment. But we want to just keep getting through the opening pieces so we have that opportunity. This is our standard disclaimer that this early child learning community is hosted by the National TA Network, but the opinions and the information that is presented today belongs to the presenters. So through our time today, we are hoping that, and when I say today, I really mean today and the time you spent with watching the recording, is we hope that you will have the opportunity to gain some additional knowledge about the importance of having a trauma-informed approach in all the work that you do. We want you to be able to come away with some how adults can support young children that are impacted by trauma. We're excited that you'll have the chance to get lots of information about a specific evidence-based trauma-informed approach, and that you will very much come away with some ideas and some thoughts about how to apply all the knowledge that you've learned through this experience to your individual communities, programs, wherever it is that you are coming from. So just a little bit more information about this flipped webinar. So we're doing lots of research and thinking about some different ways to engage all of you in this, in our early childhood learning community that Kate and I have been facilitating for about the last, together we've been doing this probably for close to a year now. And we are always excited to come together and talk about different topics, but knowing that it's the summer and that schedules are tough every day, but especially in the summer, we wanted to try this new format where our presenters came together and created a wonderful recording with information about their different presentations, and then we sent that out, and you all had the opportunity to watch that and do a little bit of thinking and reflecting on the information that you learned. And now we are here today for the next hour to give you all the opportunity to ask questions and to do some brainstorming and thinking about these really important topics that were raised. I'm going to turn it over in just a moment to Kate. She's going to kind of frame the issue about trauma and early childhood, and then she will pass it over to Amy and Caroline and Amanda, who will do very quick reviews of the information that they presented on the recorded webinar. They will not be going into depth with any of that, but just to make sure everyone's minds are remembering all that great information that they learned. And then the bulk of our time today will be your time. You all have taken an hour to listen to the webinar and then an hour out of your day today. So we are here to make sure that you have the time and the space to ask all your questions. As Tiara said, we have lots of folks that are signed up, which we are delighted about. If that means that we don't get to your question, we'll talk at the end about some ways to connect with us and with our presenters if for any reason your questions, time does not allow for your questions to be answered. So with that, I'm going to pass it over to Kate. Thanks, everyone.
Great, thanks, Lauren. And as Lauren and I were approached about the potential of this format to have really 2 different months of a webinar focused on an issue, trauma came to mind immediately because if anything deserves as much attention and interaction from you guys as participants with the issue experts, it certainly is this one. And this slide is certainly preaching to the choir for many of you that are going to dial into an early childhood focused webinar, but I think I'm often reminded whenever I talk to folks that deal with this sort of school age and up and even older adult populations that there's really a sort of a very hopeful misconception in our public discussion around the concept that very young kids and very young babies are not touched by trauma in the way that we know them to be. And so we're going to start with that as a premise. And Lauren and I had the fortune through our professional connections and those that will be joining us in just a minute to be able to reach out to people that have been dedicated to this work, but really not just the sort of sad and upsetting facts of ACEs, which has been in discussion in a great deal recently, but much more about okay, so then what? How do we support kids within these settings? And so that's what we're going to be focusing on today. And to really think about, and this is a slide that many of you have seen in many different presentations, but really just the sort of trajectory that SAMHSA thinks of when it thinks about interventions, and that trauma is not something, it's often discussed in the sort of realm of crisis treatment or sometimes recovery, but really thinking about a trauma-informed approach. This is going to be very germane to much of what Amy talked about as you guys think through what you listen to in terms of the work in Head Start, but around the whole service array, around having a trauma-informed approach, fitting into promotion and prevention activities and services, and for it to not just be a response, but for it to be part of how we interact with kids and families, especially when we know that there could be indication for something. So with that, I want to pass it over to Amy Hunter, who is an assistant professor at Georgetown University Center for Human and Child Development, where she oversees a great deal of work related to this topic itself, including mental health for young kids in general and the work in Head Start, which is what we asked her to talk about briefly. She's going to just sort of remind you guys of some of the content in her portion of the recording.
Thanks so much, Kate. It's lovely to be here with all of you and to see so many who have joined in today and hopefully who have seen this fuller presentation that was recorded. And I know on the recording I said that in the 35, 40 minutes that it was recorded, it was short, and it's even shorter today. So we are just, I'm very much just reminding you of a few of the concepts that were there, and then I really look forward to your questions and comments and hopefully a discussion. So we talked about trauma and trauma-informed care in early childhood, and the objectives of that presentation really were to define trauma, identify the signs and symptoms of trauma in infants, toddlers, and preschoolers, define what we mean about trauma-informed care, and to identify some steps and some strategies that we can implement to support families and young children that really support a trauma-informed care approach. We talked about the 4 R's, the key assumptions in a trauma-informed approach, and these are really come from a history of work and really are supported by SAMHSA. We talked about the principles of a trauma-informed approach, and I hope that we sort of revisit these through some of maybe your questions or your comments as you think about, well, what does it really mean to implement trauma-informed care in EI, in Head Start, in child care, in those kinds of other settings where you work with young children? And then we, at the end of the presentation, had a number of slides that really focused on, so what are the strategies? We talked about the theoretical approach of, the 4 R's and the principles, but what does it mean in kind of a concrete, hands-on way? What can we do with children that would sort of, what does it look like to implement trauma-informed care, in a hands-on way? And so we looked at some of those strategies. Of course, we can't talk about a trauma-informed approach without talking about creating safety and creating a safe environment, and that includes being, consistent and predictable and creating predictable routines. And that was the 5 minutes that I have to go over the just to highlight a few of the things, just to remind you and get us all sort of on the same page, reorienting about what the content was. And hopefully you had time to really listen to that webinar. But happy to answer any questions when we get to that point in this webinar. Thanks so much. I'll turn it over to Caroline and Amanda.
Yeah, and I'll just take a second to introduce them. And Amy, thank you so much for your willingness to cover such a big topic in such a tight amount of time. And our hope is really that this hour will accomplish what is typically the most useful part of any conference attendance or webinar attendance is the actual conversation. So hopefully it will be germane and relevant. So Caroline and Amanda are both from the University of Delaware, where they oversee the now international dissemination of the ABC model. And this was the second half of our recorded webinar that you guys listened into before dialing in, really looking at, going from Amy's very global and sort of specific discussion around application of an approach within systems that are child-serving to looking at a very specific clinical intervention and how that takes a trauma-informed approach, both for the caregivers and kids that it's focused on as well as the workforce. So Caroline and Amanda, you have your 2 minutes now.
Thank you, and thank you so much for having us, Pete and Lauren. This is a nice thing to get to put together, and we're so happy to talk to all of you. And I'm Caroline, this is Amanda. I'm seeing our names are switched just to give you all a nice executive functioning task for today. Our recorded webinar does go into detail about our program Attachment and Biobehavioral Catch-Up, or ABC, which it was nice to hear from Amy. Hopefully we meet some of those things that you do with the action items you do with children who have been exposed to trauma. And this is one brief program that works with very young children. So ABC aims to improve attachment and self-regulation, which are two child outcomes that we know are especially affected by exposure to early trauma. And we work with children between 6 months and 2 years. But we do have a program for toddlers and are now expanding into the more newborn prenatal stages as well as we start to identify some parents earlier. It's implemented in the home and through just 10 brief hour-long sessions. And it is includes some parenting discussion about evidence-based things that we know out there, like you cannot spoil a baby too much. You should nurture and cuddle and pick them up. But we think that the key ingredient that makes ABC work is this in vivo commenting or in the moment commenting, which I'll show you an example of in a moment. This is a nice depiction of the model and how we think it works. To the right, we have those two outcomes that we're trying to affect with ABC, attachment quality and early self-regulation. And our mechanism of intervention, what we are changing is parenting, because the parents are the ones who are with children and are most able to affect their world, and we want to improve their nurturance, help parents follow their children's lead, and to not be frightening with their children. And we do that through making these in-the-moment comments that help shape that behavior. We're not going to go through all 3 of our targets today since we're doing just a few minutes. But nurturance, actually, I think that's most well to what Amy talked about, and is really the foundation of our program. We talk about it first with our parents, for instance. We know that it's important to respond quickly and consistently to babies, because that helps foster secure and organized attachment. But that's not easy for everybody and for all families. Some kids give very clear cues for nurturance. They raise their arms up, they stop crying when their parents cuddle them. Others turn away or push their parents away or keep crying. It can be hard to know that nurturance is what is needed. And doesn't come easily to everyone either. What we do to create more nurturance and more following the lead is we make these live comments when we are in the home with parents and their children. This is an example of some different ways you can make comments. You can describe the behavior you see. Oh, when he fell down, you picked him right up. You can talk about what the behavior target is you're thinking about, or you can mention what that does. That will help him learn to trust others as we get older. And we've seen that more high-quality comments like that create more change. And we have some nice data and evidence that support this is effective. We go through some more of that in the webinar and are happy to answer any questions about that today. Thanks so much. All right. Well, thank you, Amy and Caroline and Amanda, for that incredibly difficult task of talking about your complex work and programs, and not only complex in a quick 5-minute overview, but equally complex to have given all the information that you gave in the previously recorded webinar. So those of you that had a chance to dial in and listen to the recording, you will see that at the end we had proposed a few different questions. Wanted to make sure that we were giving a little bit of guidance and some ideas for you all to do some thought work ahead of dialing in today to have the live Q&A. We have about 45 minutes left. That is your time. Please do not feel constrained by any of these questions. We really want to hear from you and what's burning at the top of your mind. But we did want to just throw these out there just as a reminder that we had put them. We had posed these questions. You are more than welcome to use this as a lens. But we also are excited to hear what questions you are bringing to the group. So just minor housekeeping. If you, as Tara said in the very beginning, if you have a question, there's a little raise hand icon at the top of your screen. So if you go ahead and click on that, then I will call on you in light of this being our virtual classroom. For those of you that are more comfortable chatting in your questions, you also can feel free to do that where you see the chat box to the right of your screen. So those are your two different options. And if you are interested in asking your question out loud and you raise your hand, then you will just need to unmute yourself, and you do that by on your phone, you hit *6. So that is it. I'm going to be scrolling through and see who has raised their hands, and Kate is going to be looking through to see who is typing in questions. And so this is your opportunity to ask Caroline and Amanda about attachment behavioral catch-up, to ask Amy questions about her presentation on trauma. Of course, can ask Kate and myself questions as well. And you can ask questions of folks that are on the webinar as well. I'm looking for this to be discussion.
Looks like a few folks are beginning to type.
Yeah. And also, just while people are putting in questions, just want to let everyone know that the recording will remain in Ideas, which is our online learning platform, and will stay up there. So if you didn't have a chance to listen before today, you will still have that opportunity.
So it looks like there's a question from Sarah. I saw that you have begun this programming in Kentucky. I'm guessing that's about ABC, Caroline and Amanda. They're asking if you guys can share anything that's going on currently in Kentucky.
It is such a small rollout there right now, but yes, we have one parent coach in Kentucky who if you want to connect with me offline, we'd be so happy to put you in touch or can share more information about it there. But yes, we can connect offline if you'd like to reach out to them.
So this is an interesting question as well. So Melissa Love, who uses currently child parent psychotherapy and Theraplay when working with caregivers and young children, wants to know a little bit about how ABC differs from these models. Would sort of pass it over specifically to Caroline and Amanda. But Amy, if you want to talk after they're done about any sort of the sort of trends or commonalities you've seen in different EVPs that are specific towards trauma, that would be great as well.
Great. So I don't know Theraplay as well, but I can talk about differences between ABC and CPP from our perspective at least. So we are similar in there are very similar theoretical foundations to the two models. One major difference is ABC is much briefer. We are only 10 sessions with the family, and our mode of our active ingredient of what we think creates change is different. So this extreme focus on our in-the-moment comments on the parent behaviors with children is a little bit different in ABC than CPP. I'd say one other difference is that we do, as you heard in our webinar, we do think about parents' past experiences and possibly their own experiences with trauma as well, but we don't delve into that in a really deep level. We think more about how would experiences like that influence your current parenting. So we touch on it, but don't really process it and go into it the same way that CPP does. And do you want to talk about the credentials?
Sure. Yeah, so we really have we've looked at this and found that like level of education or years of experience or even kind of where you've focused your work, so whether it's in social work, psychology, things like that, don't necessarily matter as much in our opinion for success as a parent coach. And so when we think about our credentials, what we look at is a pre-training screening interview that kind of gets at potential coaches' valuing of attachment and kind of these early experiences, and also their ability to make these in the moment comments that Caroline was talking about. So that is really kind of the main thing we use to have a person join our training and then go through this year certification ABC.
And just noticing, we see a couple of familiar names of certified parent coaches on that list over there. So welcome, and they can share what they thought about that screening too.
Yeah.
Amy, anything that you wanted to add about just sort of what you've seen in terms of evidence-based practices specific towards trauma-informed care?
Well, I think my presentation was really less about evidence-based practices for treatment and really more about creating a trauma-informed program or approach. Really, it comes from the roots of thinking about how to, originally the presentation was developed for how to help Head Start and early Head Start be more trauma-informed, but we've also done quite a bit of work in thinking about childcare and kind of interfacing between the pyramid model, if those of you who are familiar with that, and a trauma-informed approach. So, less about clinical interventions and evidence-based practices and more about sort of broadly, how would a program begin to infuse or begin to, wholesale, try to become more trauma-informed in their programming.
Yeah, that's really, really helpful, Amy. So that's something I'm curious if any of you all who had the opportunity to think through, does your organization or program operate with a trauma-informed lens? And that's a big question. I think it's pretty rarely that is a yes or a no. I think there's a pretty significant continuum with that, but wondering if anyone had the opportunity to reflect on that, or if there was some information or ideas you got from the presentation that you might want to share with those within your organization, and could just let those on the call know about that. Or just ideas you might have about even that first step, what it might take.
As folks are both thinking those answers through and feeling brave enough to raise your hand in a public webinar, I think one of the things that would be really interesting for us to hear about as well is not just sort of a programmatic approach that's sort of child or family focused, but I think both ABC and Head Start has done a lot to really try to support the workforce in contemplation and adaptation of trauma-informed approaches. And so I'm wondering if you guys could all talk about that a little bit.
Caroline, Amanda, do you want to start?
Sure. So how we're, can you say a little bit more about where you're thinking where you're going and what you're hoping to hear about?
Yeah. So for ABC specifically, you guys have a pretty robust supervision process. So are there ways that you specifically, because it's home-based and you're often dealing with families that have indicated traumatic experiences or needs, how do you support people that are learning how to have these reflective conversations with that trauma-informed lens?
Sure, that's a great question. Yeah, we have a very intensive supervision process. We meet with our coaches twice weekly, and some of that, there's one portion of supervision that is specifically focused on those in the moment comments that we brought up, really trying to create a model for supporting the fidelity of doing those comments in the way that we know builds parent skills. The other meeting you have each week with us is much more broad in scope, and often is a
supportive place to come and talk to us, but also their peers. We do that in a group format about some of the tough stuff you've seen that week. I think one tension that we often feel is that we have this very laser focus on changing these three things in parenting. We want to help parents nurture, follow their children's lead, and not be scary, because we know that if we focus on all the other things that are going on in these families' lives, we're not going to have time for those very basic parenting skills. But that tension of, but I want to help support the parent, talking about all these other things, is something we talk a lot about in supervision as well, because everyone has so many more needs than just those three parenting skills. I think that's a tension we feel in trying to support our coaches in that, and then also thinking through other referral sources or other kinds of evidence-based programs families should be a part of if we're not, and we don't pretend to if we're not meeting all the things that families need.
I think just to piggyback off of that too, sometimes we feel that tension in our supervision as well, so wanting to be really focused on building case conceptualization, planning for the next session, and supporting parents through those in the moment comments. But I think we work also hard to support coaches too in what we know can be really tough work with families. And we've done a lot of thinking about kind of self-care, and that we have a presentation on our website from one of our colleagues who really specializes in self-care, especially working with families with a history of trauma. And we also try to do that as well to kind of top-down support coaches as they're working with families too.
Yeah, and I would just add from the work that we've been doing, again, primarily in Head Start, but also in other child care type settings, how important it is whether the program implements reflective practice or reflective supervision, or just has some other way. You mentioned peer support groups, or some even just, and I say just, I don't mean just, but even an open door policy, with access to supervisors or access to people who can be prepared to listen and to support and really help staff reflect on how challenging this work can really be, regardless of whether programs think, that they're, working on this continuum of implementing trauma-informed care. There is no doubt that every EI program, every early Head Start program, every Head Start, every child care likely has children and families and staff who have experienced trauma. And so, having a place, ideally a routine of, taking the time each week to reflect on, the challenges that come up in working with children and families who've experienced trauma, what it might bring up, from your own life, and, how to really take care of yourself. You also mentioned that. Some of our trainings and our focus on taking care of yourself, on staff wellness, on mindfulness have been very popular, so that staff really, can be well to teach well, or to be well to take care of children and families and to help support them. And so, we know that is just incredibly important, an incredibly important aspect of, a trauma-informed care approach, or, even just of supporting children and families. I saw a question in the chat. I don't know if we want to stick with that same topic for a few minutes, or if we want to move to a different topic. I did see a question in the chat about symptoms of trauma for infants.
Yeah, go for it, Amy. I think that's right in your. I think both sets of presenters will have something to say about that. But if you want to start, Amy, that'd be great.
Yeah, sure. Well, so whenever I talk about symptoms or, signs and symptoms of trauma in infants and toddlers, I like to put the caveat out there that often many of the signs and symptoms are also totally developmentally typical, development aspects or aspects of development. For instance, eating and sleeping disturbance, clinging, separation, anxiety, irritable, difficult to soothe. If any of us have either reflecting on our own children that we have or reflecting, working with infants and toddlers, know that every, infant and toddler has experienced, eating or sleeping difficulties, right? Or separation anxiety is a part of normal development. But those are also included in the list of infants and toddlers who've experienced trauma, some of the signs and symptoms, along with some other things like language delays, and this would be that delays in the sense, delays or regressions of language, so that the language isn't developing in the way that you might expect, or language has developed and then has regressed, so that they are not speaking as they used to in terms of the number of words or the frequency. That developmental regression also might come in other areas, for instance, mobility. If they were crawling and are no longer crawling, or walking and no longer walking. Very common for the older end of toddlers who might have been more practiced with toileting and then now are having accidents. If they had already established that toilet training, that would be a very common, again, for much older toddlers and into the preschoolers, around developmental regression related to toileting. Other symptoms might be sort of this easily startled. Sometimes we call it hypervigilance, but when they hear a sound, like kind of really jumping or being startled by those sounds or noises. For older toddlers, we might see aggression, or hitting, that kind of thing, biting. Although, again, those are also normal in child development. So all of these have to be sort of taken together with what we know about the history, what we know about the child. Are these things changes in behavior? I would say there's a couple other ones, but I'll leave it at that. Maybe one other one that really crosses into the later age of toddlerhood into preschool is repetitive or post-traumatic play, sort of reenacting play related to a traumatic experience is also something to watch for. But the complication of sort of looking at these signs and symptoms of particularly the youngest children is that they are also really overlapping with child development. So, it's very helpful to know the history of the child, to know the history that the child and family have experienced, and sort of put that together with what you know about that child's behavior and development. No, Caroline, Amanda, do you want to add anything?
I think you covered it pretty well. And I would say that from like the perspective of like our program trying to intervene in that area, you said early on that this is so overlapped with normative aspects of development, and there are we, I think, try to take that approach in our work with families, that not saying this is because of the trauma that they've experienced or you've experienced, but more that some kids might react more to tickling or to intrusive play than other kids. And so particularly if kids have had some challenging experiences when they're younger, we want to instead play in ways that really follow their cues and follow their lead. So we do it in a way that's trying to say some kids might have challenges with this, whether or not we know it's due to trauma. It's so tricky to piece together the reasoning for these different areas of concern. But I think you did a lovely overview. I don't think you have anything to add.
Yeah, so Lucia has a really great question here about, how do you interpret when infants and toddlers are looking serious and not smiling as much as their peers? And I think to what both of you said, it sort of speaks to this idea of how do you delineate what's developmentally appropriate versus a child's temperament versus historically significant. So do you guys have any advice about how to watch for that type of sort of serious or worrying behavior in infants?
Well, I mean, one thing that comes to mind is also the overlap of sort of, we talked about the overlap of typical development, or but there's also an overlap certainly with other kinds of mental health or developmental concerns. And so, what could look like perhaps, a sign or symptom of extreme trauma might also be really is a sign or symptom of some other developmental disorders, for instance, like autism, right? If a child isn't reacting to others, or isn't responsive to others, or isn't, smiling, or isn't giving those kind of cues, or responsive to other cues, those kinds of things, that could be, pointing to some kind of developmental concern. It could also be related to trauma a child has experienced. And so I think, these are the kinds of things that you really have to kind of try to tease out based on your knowledge of the child, based on observations, based on working with the family and getting information from them, piecing together, whether there has been, if or getting a good of experiences that the family has had, or that the child has had. So it's not an easy answer, but certainly, taking that observational information and trying to gather other information to help you understand, what it is that you're seeing.
And I think from an ABC perspective, very similar to what Caroline was saying earlier, we are really trying to build up those sensitive responses in parents too. So I think to kind of set up that expectation that if I'm doing something, or I'm going to my parents, that I'm getting this sensitive and nurturing care and delighting care in return. So I think we try to build in those really nice sensitive interactions, I think, and set that expectation up for children.
Yeah, and I guess I would just go back to, Lucia, your question, like, what about the serious look or not smiling? The best I could say is, like, maybe, right? Like, it's hard to say, right? There are so many factors to consider, but what's wonderful about your question or comment is the level of observation, I think, that you can apply to notice that. And then to begin to start asking more questions, observing more, seeing if there are patterns, looking at, as Caroline and Amanda have talked about, the interactions between other adults in that child's life, and really trying to put together a story along with other, things that you're observing.
Sarah, I think Kate might be muted. I think she had a question. You're good, Kate.
Well, the importance of ongoing screening and conversations with families about trauma if things are being observed, that often either in clinical settings or in something like Head Start, where there's sort of this onboarding process, we'll get a lot of information about family history and that type of thing, but that families' lives are not constant, and so if the importance of asking some of those questions throughout the duration of our time with kids and families is really important as well. Mm-hmm.
So Adrienne had a really interesting, or kind of a question that seems to tie into this really well. I think this was probably posed for Caroline and Amanda, but about how you address resistance in parents, especially if those parents were unaware of trauma symptoms in their child. And that seems to be kind of a nice segue from this discussion about how do we parse out what's a result of trauma, what's a result of typical child development, what's just temperament. So if you have anything on that, that's really interesting.
Sure. Yeah, I'm glad you noticed that segue too. Yeah, so absolutely. In that we don't know that all the reasons they're coming in contact with us is from trauma. It could be for lots of different reasons. And so with the families we work with, we really operate from a very strengths-based, normalizing perspective right from the beginning of
I don't know if you can all still hear me. You can hear me because I'm connected by phone, but our computer just went black. There we go. If you felt shocked from our faces because the screen just went black. So, and you can still hear us? No, yeah.
We can hear you.
Great. Thanks. So we start with normalizing with parents. These are challenges from parents for lots of different backgrounds. Kids are hard. Dealing with a crying infant is hard, especially if you did not have someone who nurtured you when you were a baby or someone who followed your lead when you were a young child. So we start off with that perspective, and also in our opening conversations, really try to position ourselves more as like supportive consults, or we call ourselves parent coaches, right? That we're there alongside you, but we bring the research, but that you are the expert in your child, not us. And so try to set that up front pretty explicitly, but then also in the way that our